I'm James Eule. I'm orthopedic trained and fellowship trained spine surgeon. I think spine surgery is certainly in the last 10 to 15 years has had one of the most dramatic advances in multiple techniques, and some of the minimally invasive techniques with spine surgery in the lumbar spine. Some of these new lateral approaches, they call them X-lift or something, that for some of these people, fusion may have been 3 or 4 days in the hospital, and now some of these we can even do as an outpatient. And cervical disc replacement, as I briefly mentioned before, it has been around in other parts of the world for probably 20 years, but in approximately 10 years in the United States, and it's certainly gaining more and more favor, and the data is better and better. But it's an ideal type of procedure for someone in the cervical spine. They have a large disc herniation and it's pinching on their spinal cord, and otherwise a reasonably healthy patient, younger patient who wants to maintain their activity. Our only option in the past for a big central disc herniation compressing on the spinal cord was a fusion. Now instead of fusing or having the bones grow together, we place just like a total hip or a total knee. It's kind of a metal on plastic device that replaces where the disc used to be, so we can go in there and get out the herniated disc or any bone spurs or things that are pinching on the spinal cord or nerve roots. And patients seem to have quite a bit less pain than when we do a fusion, and overall just a faster recovery. And with a young person who wants to get back to activities, they've done studies that even Air Force pilots who are flying fighter jets, if they have a one-level fusion, they're often disqualified from being a fighter pilot anymore. But with the disc arthroplasties, they are able to get back to full duties. And these seem to be lasting many, many years. Similar, if not longer, than total knees and total hips are.